Everyone, this will be a short presentation about cancer patient navigation on PEI. I'd like to take a moment to thank the organizers of the conference for the invitation to speak and for the incredible amount of work they've put into delivering this event for the benefit of patients and families, organizations, and healthcare providers. A little bit about myself. My name is Michelle, and my title is Provincial Cancer Patient Navigator for Health PEI. I'm a licensed practical nurse by training, and I have a Bachelor of Arts degree majoring in psychology. And at this time, I have 20 years of experience working in a wide variety of healthcare settings, including long-term care, acute care, mental health and addictions. And since 2020, I've been working in cancer care. So I wanted to start this presentation by sharing a little bit about what patient navigation is. It's often described as a service delivery intervention. It helps patients overcome systemic and individual barriers to care. And I'll talk a little bit more about what those barriers might look like in a few slides. But when we think more broad and generally, we can include all kinds of things under the umbrella of patient navigation. Things like brochures, websites, public education sessions. These are all patient navigation tools. They're helping someone find or access the care they need. Also, many healthcare workers, such as doctors and nurses, navigate patients through the system every day as part of their regular duties. But a patient navigator is someone whose primary job is to help patients navigate the system. It's what they specialize in. A patient navigator is often described as a liaison. They help bridge any disconnects between patients and the healthcare team or resources that they may benefit from. Having said that, not all navigators do exactly the same thing. The scope of practice for navigators is quite wide, and depending on the goals of the organization or program, the navigator may be concentrating their attention on one specific need to get the patient from point A to point B. For example, an oncology navigator may be hired by a screening program to ensure that the patient is supported in getting to the next step if a screening test indicates that further testing is recommended. So the navigator might help the patient understand their test results, make referrals, provide emotional support, but it's always within the context of making sure that the patient who has screened positive receives the imaging or biopsy or whatever the next step should be in their care. And once the patient gets to the next step, the navigator is no longer involved in that patient's care. So this is one example of what an oncology navigator might do. Other navigators, such as myself, are not embedded within any specific program or service, so individuals can self-refer to me regardless of where they're at on their journey or even what the need is. Perhaps they have questions around screening or diagnostic imaging, or they may have recently moved to PEI and need help accessing treatment or surveillance, or they maybe want to connect to community resources or support groups. So to give you an idea of what my day typically looks like, I'd say there are a lot of phone calls and emails with patients and family members, but I also do some in-person meetings at the two treatment clinics we have on PEI. I sometimes lead support groups in the community, provide orientation sessions at the treatment center, and present information sessions for the general public as well. I also work on quality improvement projects with other cancer care providers and program developers. And occasionally I present to leadership to help bring awareness to system issues and challenges that patients are encountering on their journey. Because as you can imagine, navigators are often in a very unique position to track and to trend these kinds of issues. So a common goal for many navigation programs, including the role I'm in, is the reduction of health disparities by identifying and supporting underserved populations. These individuals have additional challenges beyond their diagnosis that make it harder for them to access their care or participate in their health care. Navigators like to stack supports under the patient as much as possible, so they're on a more equal footing and more likely to reach their healthcare goals. In my role, some common examples of individual challenges that lead to health inequities include living in a rural area, not having access to public transportation or a drive to get to treatment, being unable to afford prescribed medications or medical supplies is another example. Perhaps being a newcomer to Canada and being unfamiliar with the healthcare system. So reducing these disparities might involve accessing special funding programs, helping the patient fill out applications, referring them to a healthcare service, connecting them to resources in the community, booking translation services, or simply providing information about what the next step in their care might look like. So much like precision medicine, patient navigation is a personalized approach to care. It's tailored to the specific socioeconomic needs of the patient and their family. However, the challenges are not always patient-related. PEI is one of the fastest growing provinces in Canada, and because our population has grown so fast, much like the rest of Atlantic Canada, the demands on the healthcare system have grown too. So our old ways of doing things are sometimes inefficient or ineffective. The system needs to grow, but as it grows, it often becomes increasingly complex. The challenge is to grow the system while still making access to care a simple process for patients, and that's not always easy. It also takes a lot of time to build the programs and services. So some common system barriers include high wait times for services, not having a primary care provider such as a nurse practitioner or a family doctor, and needing to travel out of province for specialist care. I like to think of patient navigators as professional problem solvers. We try to put the pieces of the puzzle together. So when things aren't quite lining up properly, we try to find the fix. We can't fix every problem for every individual, but if there's a solution to be found, the navigator is highly likely to know about it and can help you access it. If there are no solutions to be found, the navigator becomes an advocate for system change. So how do you connect with patient navigation on PEI? Well, you can search for PEI Cancer Patient Navigator on the internet, and you'll find a web page that provides my contact information. I receive referrals from healthcare workers, social programs, community workers, but the easiest way for people to connect with me really is directly through a self-referral. My phone number and email are online, and they're on this slide as well. I also want to briefly mention Shelby and Chrissy, our two Mi'kmaq health system navigators in PEI. These ladies are experts in navigating the resources and special funding available to Indigenous people on PEI. So again, a quick internet search will bring up their contact information, or you can feel free to reach out to me and I'll put you in contact with their service. So in closing, once again, I'd like to say thank you for the opportunity to raise awareness about cancer patient navigation, and I'm really looking forward to checking out all the other presentations being offered at this important event. Thank you, and take care.